If your pet has been diagnosed with diabetes, you can take comfort in knowing that with appropriate treatment and regular visits to your veterinary professional, it can continue to lead a healthy life. You can help manage your pet's diabetes with VetPen, an insulin pen designed for use in diabetic dogs and cats. This video will provide you with step-by-step instructions to help you use VetPen to manage your pet's diabetes. VetPen comes in 2 volume sizes. The size you will use depends on the dosage your veterinary professional determines for your pet. No matter which VetPen you have, the instructions for use are the same. First, let's review the individual components of VetPen. The VetPen cap should be removed before attaching a needle and preparing VetPen for use. The main body of VetPen is ergonomically designed for easy handling. The dose selector allows you to provide precise doses simply by turning the dial. This reduces the chance of error by eliminating the need to manually draw insulin doses from a vial with a syringe. Never attempt to forcefully dial back the dose selector, as doing so may damage the pen and result in inaccurate dosing. The dose selector adapter may be used to provide a better grip when selecting a dose. The release button is used to inject insulin into your pet after inserting the needle through your pet's skin, as instructed by your veterinary professional. Pressing and holding the release button releases the internal plunger, which causes insulin to be expelled through the needle. The release button extension may be used to provide a better grip when giving injections. The insulin cartridge allows you to administer multiple doses. When all the insulin has been used, simply remove the empty cartridge and insert a new one. Please note that VetPen is designed only for use with cartridges containing 40 international units per milliliter of Caninsulin manufactured by MSD Animal Health. When you push the release button, the internal plunger pushes the small red stopper at the end of the cartridge to expel the selected insulin dose through the needle. The sturdy cartridge holder protects the insulin cartridge from breakage during storage and transit. The numbers on the cartridge itself indicate the insulin units left in the cartridge when you hold the pen with the needle pointing downward. VetPen uses ultra-thin needles that feature a silicone coating to help minimize injection discomfort for your pet. VetPen is designed for use with 29-gauge 12mm pen needles only. These are the only needles that should be used with VetPen. Each needle comes with 2 protective caps for safer handling. The needle remover will help you to remove used needles while minimizing the risk of accidental needle stick injuries. Let's take a closer look at how to prepare your pet's insulin injections before using VetPen. We'll start by loading an insulin cartridge. First, remove the VetPen cap. Then, unscrew the VetPen body from the cartridge holder. The arrow on the VetPen body should point to 0, which is the starting line on the dose selector. If it is not, push the release button. Check to make sure that the internal plunger is fully retracted. If not, you'll need to rewind the internal plunger by holding the white lower part of the VetPen body between your thumb and finger. Turn the VetPen body gently in a clockwise direction until the internal plunger is fully retracted. Prior to loading a cartridge, invert it at least 10 times until the insulin appears uniformly milky. Only use the cartridge if the insulin is uniformly milky after mixing. Load the cartridge by inserting the metal cap first into the holder. Next, screw the cartridge holder and VetPen body gently but firmly together. Before you prepare the first insulin dose, you need to prime VetPen to remove air from the cartridge and ensure it works properly. Take a new needle and peel off the protective film. Screw the needle onto VetPen and remove the outer protective needle cap from the needle. Replace the VetPen cap to cover the needle. Now, mix the insulin by turning VetPen up and down at least 10 times. Dial 1 unit on the dose selector. Then remove the VetPen cap and the inner protective needle cap. Keep a clean, dry piece of tissue or swab handy to absorb any insulin that comes out of the needle tip during the priming process. Hold the pen with the needle pointing upwards. Tap the cartridge gently with your finger a few times to push any air bubbles to the top. Push and hold the release button towards the needle until the arrow on the pen body points to the starting line on the dose selector. Repeat these steps with VetPen pointing upwards until you do not see any air in the cartridge window and insulin comes out of the needle tip. You may need to repeat these steps a number of times. This means that VetPen is now ready for use. Your pet's insulin is now ready for injection. Make sure the arrow on the VetPen body points to the starting line on the dose selector. Select the number of units that has been prescribed by your veterinary professional by turning the dial. Make sure that the arrow points toward the correct number of units on the dose selector before proceeding any further. If you select a dose that is too high by mistake, expel the incorrect dose safely and then select the correct dose. Do not attempt to forcefully dial back to a lower dose, as doing so may damage VetPen and result in inaccurate dosing. Usually, insulin injections are given under the skin 2 to 5 centimeters or 3/4 of an inch to 2 inches from the center of your pet's back along its flanks. Make sure to rotate the injection site as advised by your veterinary professional. As shown here, you can inject your pet between the area behind the shoulder blade to the middle of the lower back. Insert the needle through the skin using the injection technique recommended by your veterinary professional. Then push the release button towards the pen needle and hold it in place until the starting line on the dose selector returns to the arrow on the VetPen body. Hold the needle in place for a minimum of 5 seconds. Counting slowly to 5 to ensure the entire insulin dose has been delivered. Then remove the needle from the skin. If the dose selector stops before the start line returns to the arrow, this indicates that your pet has not received the full selected dose. If only a partial dose was administered or your pet dislodges the needle before you count to 5, do not administer more insulin at this time. Wait and give your pet the usual dose at the next scheduled dose. If you are injecting your cat, you follow the same instructions using the injection technique recommended by your veterinary professional. After completing the injection, remove the needle by inserting it in the needle remover and unscrewing it. Press the blue tip on the needle remover to release the needle. Always check to make sure the pen needle has been removed. Dispose of used needles carefully in accordance with the advice given by your veterinary professional or local regulations. Replace the pen cap onto VetPen. When preparing for the next injection, you can skip the priming process as long as there are no air bubbles visible in the insulin cartridge. You should always prime VetPen whenever you insert a new insulin cartridge. Now you will learn how to change the insulin cartridge. Before changing the cartridge, always make sure that the pen needle has been removed to prevent accidental injury. Then, unscrew the cartridge holder from the VetPen body and remove the cartridge. Rewind the internal plunger by holding the white lower part of the pen body between your thumb and finger. Gently turn the VetPen body clockwise until the internal plunger is fully retracted. You are now ready to load a new cartridge as shown previously. If the dose selector does not return to the starting line and no insulin is expelled after priming, then you need to check the needle and the cartridge. The needle that you are using may be blocked. Safely remove and dispose of the needle currently attached to VetPen with the needle remover before replacing it with a new one. The second possibility is that the cartridge plunger may be stuck. To solve this problem, place the outer protective cap back onto the needle. Unscrew the cartridge holder. Slide the release button towards the internal plunger and hold in place until the starting line on the dose selector returns to the arrow on the body. Next, dial 2 units on the dose selector without screwing the device back together. Push and hold down the release button towards the internal plunger until the starting line on the dose selector returns to the arrow. Without rewinding the internal plunger, screw the cartridge holder and the VetPen body back together gently but firmly. This will release the cartridge plunger and expel some of the insulin. You now need to prime VetPen to prepare it for use. Please follow these safety precautions when using Caninsulin VetPen. VetPen should be used only in consultation with your veterinary professional. Always ensure that the VetPen has been primed before use. Failure to prime the VetPen could result in inaccurate dosing. A new needle should be used for each injection. The needle is designed for single use and should be removed with the needle remover and safely disposed of immediately after each injection. Be sure to consult your veterinary professional if you have difficulty injecting your pet, if you are concerned about your pet, or if your pet does not appear to be responding to treatment. Before use, keep the insulin cartridges refrigerated and protected from light. Do not freeze. For further guidelines, check the approved Caninsulin package insert. VetPen should always be stored or carried with the cap on and no needle attached. To clean VetPen, wipe it with a damp cloth. Do not immerse it in water. Your VetPen starter kit includes a travel pouch to carry the VetPen with you when away from home. It can hold the VetPen, needles, sharps remover and insulin. You are now ready to use Caninsulin VetPen to help manage your pet's diabetes. Effectively managing your pet's diabetes with your veterinary professional's advice and appropriate treatment, diet and exercise can help your pet to continue to enjoy a healthy, active lifestyle. Talk to your veterinary professional if you have any questions about managing your pet's diabetes